And Matt, Delaware Dream Center.
Hello, thank you. Yes, my name is Matthew Morrison. I am the Executive Director for the Delaware Regional Dream Center, registered nurse and a pediatric trauma nurse for the last 14 years, as well as 10 years experience in global health community-based primary care. And so with this, we at the Dream Center, which is located in Newark, 310 Ruther Drive, for the past 3.5 years, we've initiated a hunger relief program. So in the hunger relief program, Community of Hope and Healthy Children program, we started helping 30 to 40 families each week, and that has now grown to over 200, around 960 families each month, Delaware residents, and we're up to around 940 participants in that program. 2 years of that program has led us to dive further into understanding the needs and wants of these families that come each week seeking services here at the Dream Center. So as we questioned them, we found out that the fentanyl, opioid, any type of addictions that these families were struggling with, we needed to develop a second program. So I wrote the Restoring Hope Community Outreach Program. At the same time, Lieutenant Governor was rolling out the opioid abatement. So I applied for that grant, received funding from them, so thankfully, as well as from the state of Delaware. We then worked with the Naaman Center through a program that they have 15 outpatient services. They have a table outside here in eastern Pennsylvania, and they just partnered with the Dream Center so that we could have a two-tiered program, Living Free. It's a free service here at the Dream Center. It's helping individuals and families in the community dealing with life-controlling problems and to help them find wholeness. And it consists of about a 12-week program. And through the funding, we were able to start the program January 8th of this year. We just completed it, and we're starting our second 12-week program here the first week of June. And this is going to continue throughout the year. And this is to reach people for all sorts of issues life-controlling issues such as drug addiction, alcoholism, sexual addiction, gambling, and many more serious issues. If we do find that the participants of our program that's free need a little bit more intensive, then we refer them up to the Naaman Center. So the Naaman Center, they provide comprehensive outpatient services and care for substance abuse disorders through medication-assisted treatment and intensive outpatient programs. Adolescents ages 14 and up, and they do accept private insurance. Medicare and Medicaid is accepted. So the budget, we received $100,000 from the opioid, and in the first quarter we were able to deliver by hiring the staff appropriate to sustain the program, training materials, rent, utilities for the space inside the Dream Center that's being occupied for these programs, for the 8-week training sessions to get the 12 counselors that we do now have on site to help through this program, and the promotional materials. In our first class, we had 36 individuals that signed up for counseling, with sessions beginning on, like I said, January 8th. 10% of the sessions were completed by the first quarter. Then we received the next portion, the second quarterly deliverables. We completed the 12-week Living Free sessions. DSAM came out and we did the training for the counselors, and we now have those kits on site, and we utilize those kits and the training materials to go and do outreach in the community to meet the people right where they're at, right where they need to be, so that they don't feel like they need to come into a space. We want to go out to them. So it's primarily, it's 50-50. You can come to the Dream Center to receive care, but 50% of our work is done outside in the community. Random substance abuse surveys that we utilize each week through our drive-through food pantry is conducted on the community. And right now, in just this 6 months since starting the saturation campaign, we've reached 2,127 individuals. So in the third quarter of our that we just completed, the deliverables. We opened up the Naaman Center. Through funding through the state of Delaware, we were able to construct it has 3 offices within this space for the substance abuse counseling, the intensive outpatient counseling center. So we had the Lieutenant Governor there for that. That was on Thursday, April 4th. And we have an on-site director, and we have a counselor now that will be starting in a couple weeks. We opened the Naaman Center. Community surveys continued, and we are now, like I said, prepping for our second 12-week session of Living Free. And just quickly, the Living Free is a tiered program within the tiered program. You have the people that complete the 12 weeks, and they go from living free to completely free into the second level. And then the third level, they're going to get trained and helped to become the counselors so it can become self-sustaining. And finally, thank you. This is my contact information. Yes, the Dream Center at dreamcenterde.org. We're on Facebook, Instagram, and LinkedIn. And the final slide, I think, is other resources that people can get when they can sign up on the QR code to come to Living Free. But that's what we do at the Dream Center. And like I said, Naaman Center has a table out here. Feel free to check them out as well. Appreciate it. Thank you.
It's amazing to hear about the work that all of your organizations are doing as a result of this funding. Really